Hi, I'm Dr. Amerjeeth and welcome to the Scalpel, where you can learn about concepts in surgery, clinics, operative surgery, and practice essentials. So the first step in suturing is to learn how to handle a surgical instrument. This is a needle holder, this is a ratchet, and these are the rings. Insert your ring finger and thumb finger into the rings of the needle holder. Place your middle finger at the junction of shaft and the ring, and your index finger at the box lock or the hinge of the needle holder. If you exert pressure near the ratchet, the needle holder unlocks. So you are supposed to exert pressure near the hinge of the needle holder. So don't give pressure here, give your pressure here. So the next step is to learn how to hold the surgical needle. So always hold the surgical needle at the junction of 2/3 and 1/3 of the surgical needle. So you grab the needle at the junction of 2/3 and 1/3 using the needle holder and adjust it using your thumb forceps. And remember to hold the needle using the tip of the needle holder and not like this. Because if you hold it like that, whenever you are taking a deeper bite, your needle holder will hit the tissue and damage it. So whenever you are taking a bite, you are supposed to enter the tissue at right angles. Can you see the amount of pronation which is required to take the bite? Yeah. So always enter at right angles. You can assist this by holding the tissue with the thumb forceps and everting it. Curve and take the needle out. Look, I am not pushing it. I am curving the needle and taking it out. Realign your needle and take the next bite. So the technique is to take less of skin and more of subcutaneous tissue so that there will be better approximation. Hold the needle like this away from you and pull the excess thread into your left hand. This is a technique in which you can make an 8-leg figure. This is how you are supposed to keep the excess thread within your left hand. So this forms a V. Make a forward loop within the V. So the idea is to make a loop always within the V. So after throwing the loop, always hold the tip of the thread and cross your hands across the surgical wound. This again forms a V. Throw another reverse loop within the V and hold the tip of the thread to straighten the knot. This forms a reef knot, and always make sure that the knot falls on one side of the wound and not directly over the surgical wound. This again forms a V. So repeat the process until the knots which you required are done. So once the suturing is done, you can hold the instruments in your left hand and cut the excess suture with the scissors. That's it for today, and thanks for watching. If you like this video, share this with your friends and subscribe to my channel by just clicking right over here. And if you want me to make videos on specific topic, let me know it in the comment section. Thank you.